So my name's Dr. Samantha Kerr and I'm the Chief Scientific Officer at MERZ Aesthetics, and I lead the R&D team, so the Research and Development team at MERZ. So MERZ Aesthetics has just over 200 scientists around the world, and my role is to guide those people to develop new drugs and bring those drugs to market. So my teams are working on all aspects of drug development, from very early development all the way through to submissions and approvals. And so that's what I do. I oversee all of that. I think no matter what the discipline in medicine should be, I think you should always apply the most rigorous standards. So we want to ensure that our products are efficacious, they do what they say, but also safe and of highest quality. So for me, it's really important that we hold ourselves to the standards of every other medical discipline to make sure our products are efficacious, safe, and top quality, so that our customers feel confident using them when they use them on their patients. I think there's the differentiation between cosmetics, like L'Oreal, and then medical aesthetics. So when we speak about makeup and 9 out of 10 women prefer this lipstick, that's very different to when we speak about our product. So I think there's the different levels. I see medical aesthetics with normal pharma. And the reason I say that about MERZ Aesthetics is because we have the biologic Xeomin. So that's a true drug. And I think that's what differentiates us from the cosmetic side of the area. I think that when I started my journey as a scientist and I worked on aesthetics for many years, it was very simple. The patients didn't really know what each different drug was. They didn't really know, and the doctors knew. Now patients are so much more educated. They want to know what the drug is, what does it do, but also what are the ingredients. Everybody now is considering the planet, what they put in their bodies, what are the side effects. And I think that science and beauty are almost converging. So now it's people are making informed decisions. And so science will play a huge part in every single decision I think that the consumers, the patients will make. Because we want to make sure we commit to our customers to make sure we deliver the best products. And that is essential for us, both as scientists, but also as, commitment to our customers, and as MERZ always wants to give the opportunity to make people look better, live better, feel better, and that's really important to us. And so the only way you can do that is by ensuring you have the best products. I think for every pharmaceutical product, whether it's for therapeutic use or aesthetic use, increasingly it's about how the patient feels. So in the past it was how the doctor thinks it is doing, but now it's how does the patient feel. So for example, if we take a therapeutic indication like spasticity, for which our neurotoxin is used for, you will ask patients, do you still feel pain? It's not just about you can move the arm, which is the efficacy, it's also do you have pain? In the aesthetic world, we ask patients, how do you feel? What do you feel you look like? Do you feel satisfied? Do you feel more confident? And that really is the goal for aesthetics, is to make everyone feel confident to be their best selves. And that is very different for all of us. But I think that's really important. So we call it patient-reported outcomes. And increasingly, I think that is almost more important than what the physician thinks. It's how the patient feels. regardless of if it's aesthetics or therapeutics. And I like that. Of course, so we are continually looking for new ideas. Why I'm here today, this week, is to speak to our customers. So at MERZ Aesthetics, customers are everything. And it's so important that we speak with them, understand what they want in the marketplace, what is missing. Our very founding person, Friedrich MERZ, he was our founder and always asked the question, what is needed? So we do the same now, and we speak to people in Korea, in Taiwan, in the rest of the world, and ask them what they want. It's a good question. The main focus is to drive innovation. The main focus is to drive innovation to bring new products to the market. That is the very heart of my team. Yes, of course. Well, MERZ Aesthetics is very, as I said before, is very customer focused. So we really want to provide new products for our customers and our patients. We invest across all of the pipeline, so all those 4 products. We also invest a lot in early development, where we're looking for new formulations, new ways of delivering things. And on average, we invest about 10 to 15% of our revenue on an annual basis back into R&D so that we continue to fuel the pipeline as we move forward. I think the things we're looking at now, and talking about like Xeomin specifically, we've just started a new platysma, so the platysma bands project. We're looking forward to having that approved globally. We're looking at skin quality indications, but we have many, many ideas. My team have about 30 projects in the pipeline across all of our 4 main products, which are Xeomin, Radiesse, Belotero, and Ultherapy. So many, many more things to come. So we are always looking externally for partners. And I love being in Korea because I truly believe Korea is at the cutting edge of so much when it comes to aesthetics, and I learn so much when I come to speak to the doctors here, and I really appreciate them. We're always looking for external opportunities worldwide, but at the moment we have nothing on the books yet, but we have a business development group that's always looking for opportunities, and we never say no to assessing things. Yes, the world of digitalization, AI, everything has just exploded. We try to use as much as we can in terms of automation. So all the way through MERZ, from R&D, we're looking at different ways of developing new formulations, all the way to manufacturing, where we try and do as much automation as possible, all the way through to our packaging, try and make ourselves environmentally friendly as possible. And so technology comes into everything. It seems to be so fast now. In the past it wasn't so fast, but now with AI coming in. So my teams continually assess what is out there and bring it back in to try and incorporate that into our R&D programs. And we do a very good job of that, but it's keeping up with it can be tricky. But no, we really enjoy it. It's good. No, that's excellent. So I think the personalized medicine, it's almost that aesthetics leads that. So when you take a therapeutic indication, say you're taking a tablet, you will take 1 tablet a day. When it comes to aesthetics, the patient walks into the clinic, and what I would say to my doctor versus someone else is completely different. They start the conversation with, well, what worries you? What do you want to improve? You treat the patient so that the patient knows how they want to look. They know how they want to feel confident. And so there is that variation. But we do give as much guidance as we can to ensure patient safety. Now, for each of our indications we get approved, we do have guidances as to what dose you can use. So we do provide that, and we also provide injection paradigms. So in our labels, we will say you can inject this much product in these areas, and you will see diagrams of facial areas, for example. And so physicians should stick to those amounts of product and also the areas. So we do have that. I think there are a lot of botulinum toxins now on the market. And what we are seeing is that patients are starting treatment with botulinum toxins much earlier than they used to. And so patients will be using botulinum toxins for many more years than they used to. And in addition to that, botulinum toxins are used for both therapeutic and aesthetic indications. So someone could be receiving botulinum toxin type A for a therapeutic indication from one doctor, and then an aesthetic indication from another doctor. So the most important thing we need to take into consideration is to ensure the patient will continue to have treatment success. And by doing that, it's selecting the right type of toxin product that you need to select for your patients. So we would recommend that you use a pure toxin, which is a toxin that only has the part of the molecule that's required for biological effect, not a molecule that has all of these. There's many formulations out there with accessory proteins and non-relevant proteins, because if you inject more proteins into the body, you are likely to encourage resistance. And so for us, the things that customers and HCPs need to consider is what is the best product to treat your patients with. And we believe it's the pure product, which just contains the part of the molecule that you need for effect and nothing else. I would like to leave the comment that we at MERZ are committed to them. We truly appreciate them. From an R&D point of view, I love the innovation and all the technology that Korea is driving. It's such a delight to be here. But to let them know that we will continue to push our pipeline to provide them new products in the future, and those products will be of the highest quality standards, both safe and effective, and proven so that they have the confidence to use those products.